Hello and welcome to the IdeaCast interview series, episode number 146. My guest in this episode is Dr. Tracy Kim Townsend, and Dr. Townsend got their medical degree from the University of Virginia School of Medicine, and they went on to do a 5-year residency at the Harbor UCLA Medical Center in LA, followed by a fellowship in pediatric orthopedic surgery at Boston Children's Hospital of Harvard University. And I have Dr. Townsend on in this conversation to discuss a project that she founded. It is Meadow Medicine, and it is psychedelic assisted therapy. So Dr. Townsend and her committed team are working to help people with that process, with the follow-up of that process of engaging with psychedelic medicine. Really inspiring conversation. I was really glad to have Dr. Townsend as a guest, grateful for her coming on to speak with me, and I hope you enjoy this conversation as well. And thank you so much for being here. And I'd like to welcome Dr. Tracy Kim Townsend to the IdeaCast interview series. I will confess that Tracy and I were just having a little sort of pre-record conversation, and we were just exploring territory and space. So I know this is going to be a really good conversation. And in the beginning, I want to introduce or have Dr. Townsend introduce herself to you, the audience. And by the way, welcome everyone. And then we're going to just explore the work that she's doing now. So Dr. Townsend, welcome. It's wonderful to have you here on the show.
Well, thank you so much for having me. I'm really excited to be here. For those of you who don't know me, I'm a licensed medical doctor. I actually trained as an orthopedic surgeon and subspecialized into pediatric orthopedic surgery. So, musculoskeletal conditions in children. But along the way, I had some transformative experiences, really exploring my own psyche and consciousness with psychedelics, with psilocybin specifically, and with everything that has opened up, specifically with the legalization of psilocybin therapy within the state of Oregon. I found myself answering a new calling, sort of as I'm, entering mid-career here, and decided to pursue becoming a licensed psilocybin facilitator. And then I moved into psilocybin facilitation full-time about 2 years ago. So I'm now I co-founded a psychedelic medicine organization called Meadow Medicine, and we serve psilocybin here in Portland, Oregon, is where our service center is located. And I say our mission is to awaken the healer within with psychedelic medicines more broadly, but starting with psilocybin, since that is what is legal to work with currently, and also to just assist in the flourishing of life on planet Earth as we expand our understanding of consciousness, and specifically human consciousness. So, that's a little bit about me and what I do.
Yes, and thank you for that. And what I will do is invite you to share an anecdote or a story that you've told in other conversations that I think would be important for people to know sort of what the driving force behind your, first of all, your foray into psychedelic use and your realization about the power of transformation that plant medicine has. And so I speak to your early years, your childhood, and the experience that happened there. So if you're comfortable sharing that and you want to bring that in, and again, that speaks to what you do now with people and the potential for change that occurs.
Yeah, I would say what initially more conscious, so in my conscious awareness, what initially drew me to psychedelics and experimenting with them was really, I would say, curiosity more than anything. Okay. I didn't start experimenting with them until my late 20s. I had just graduated from medical school. I was entering what felt, I'd gone through the bottleneck of matching into orthopedic surgery, graduated medical school, was just starting out in residency in Los Angeles. And I felt like I should have been sort of on top of the world. I had achieved my dream. I had it was just like yet another rung on the ladder, another step up the mountain that I had sort of achieved and unlocked, and being just like a classic overachieving, perfectionist kind of kid, I had thought that would bring me some sort of, level of peace or fulfillment or something, and to be able to relax from the constant stress and striving and that sort of thing. And I was not feeling that way at all at 27. I had just moved across the country. I would say I was kind of very much deep in the seeking of the meaning of life at that point. I was pursuing this, noble pursuit, becoming a physician, trying to serve humanity in the way that I felt like was my calling really from as a child. And I was, pursuing that. And I was like so disconnected from my work at the time. I burnt out on medicine before I even really entered even into residency. So I was quite disillusioned with the healthcare system that at the time, didn't really know if I really was having an impact on people's lives or if I would. I would say my mental health at the time had kind of reached it had been up and down through medical school. And I say going back to when my father passed away, passed away when I was 20 years old. And so quite suddenly. And so, I had a lot of unprocessed grief at the time as well, that I was, fairly aware that was impacting me, but not to the level that I now understand that it was impacting me. And I think I had certainly some reservations with exploring psychedelics, knowing that I had that level of sort of grief and trauma that I had unprocessed that I was carrying. Those first few experiences, I describe it. There's so many different ways to describe it, but on some level, it was an enormous relief to have what I now understand to have undergone just like complete ego dissolution, which I had built up this entire identity and this cadre of survival adaptations that had ultimately were starting to become maladaptive. And I got to wake up to all of that, to all of the little self that was creating and perpetuating the core beliefs that I was carrying, that I was not safe or I was not valued or I didn't belong or whatever it is, that these sort of core psychic wounds we kind of develop as part of our individuation process. And so it was like a whole opening. It was like getting access to the rest of my consciousness is what it was. This is like just total consciousness expanding experiences, several of them in those first few years of residency. And along the way, I'm developing and furthering my understanding of what health and healing and just life and death and birth and all of it, like psychological death and rebirth, all of it, and how childhood and intergenerational trauma play in the, our individuation process, and how that is so intimately tied to, really just behavior, day-to-day behavior and lifestyle sort of choices that are conscious and mostly subconscious and unconscious choices. And how so much of the disease and what we were being faced with, and I was doing training in South Central Los Angeles. So, if you want to talk about social ills and how that plays its parts in the social determinants of health, I was just sort of understanding the outsized role that the mind and the psyche play, and how we are, it seems like in modern allopathic medicine, just completely disregarding that piece of things and focusing on sort of way downstream effects of when dis-ease manifests as disease in the body. And so I became fascinated and just utterly consumed with consciousness, and every spare moment I had was about learning about the research and just understanding our psyches and consciousness more. And I was attending, psychedelic medicine conferences. I wasn't as excited about attending, orthopedic surgery conferences. Yeah. So my heart was like pulling me in that direction for, already back in sort of when I was midway through residency, but there was no path at the time for, pursuing, psychedelics as medicine legally. And so I was just, I was committed to finishing out my training. And then along the way, though, that's when Measure 109 passed in Oregon, which legalized psilocybin therapy in 2020, which was the last year of my training officially. I was doing fellowship in Boston Children's at the time. And I was thinking like, okay, maybe I spent all these years, gathering these skills to become, an orthopedic surgeon, which really, if I look at the roots of what drew me to orthopedic surgery, it was, just fascinated by musculoskeletal health and body as interface with reality, and how so much of our reality is mediated through our ability, our musculoskeletal system. And so I even thought about how we can, and still think about how we can weave in psychedelics into specifically musculoskeletal health and conditions and that sort of thing, especially the way that chronic inflammation manifests in the body and emotional health and all of these sort of different dimensions. But yeah, I practiced as a pediatric orthopedic surgeon for a couple of years. But then the opportunity came to start my own practice, and just with everything that I had studied and with all my understanding, I could just see that psychedelic medicines are going to change every aspect of medicine. It's really the birthing of a new paradigm within medicine that I think a lot of people still aren't aware is happening, and especially with what's going on with, with AI and how rapidly we are evolving as a species, with how interconnected and sort of hyper-connected we are with the internet and socially. I'm just so inspired by what these medicines can do for us, especially at this point in history. And it was a bit of a process to disentangle sort of my rational kind of mind and where the passions of my heart were kind of pulling me in two different directions for a bit. But I learned, if there's one thing I've learned, is to listen to my heart a little bit more as life goes on. And so, this is where my heart is and where my passion is, and helping to teach people, which is what I do now for a living, which is really surreal when I think about it, which is just like teaching people how your mind actually works, how your psyche, as a human works. Like the even idea that we have an ego identity is still such a foreign concept to most people, unless you're, practicing meditator or something like that and exploring these kind of, Eastern philosophies have understood this for millennia. But modern Westerners are still fairly ignorant to all of this. And so helping people to really understand themselves as more than their ego identity, and also awakening people to the power that we have to rewrite or our conditioning, to recondition ourselves. And also there's, especially when you leverage things like the neuroplasticity that you get with psychedelics, life becomes really interesting after that. And I think it's been incredibly empowering too. Okay.
Now this question might be moving. I think it's appropriate for the space that we're in right now, but I do want to explore some of the what Meadow does and what you are doing in Oregon legally and your responsibilities. But I got a question that came to mind in what you were just saying about when one is doing psychedelic assisted therapy. I wonder, is there a sweet spot of dose intake that would afford somebody the same perhaps space or opportunity that when one is in hypnotherapy, one becomes open to suggestion or open to what I would call the imaginal, like opening up the space of possibility. And you have the neurophysiological things that are going on, but also the affective things. So I wonder, has there been any research in psychedelic therapy? Obviously there's microdosing, and then maybe I'm in the mesodosing domain here. And then there's obviously like hero stuff over here. Do you know of anyone or have you noticed that there is this space where you can have a therapeutic session, either a coaching or maybe someone who's a licensed clinical social worker or a psychotherapist, if psychedelics have a role there? Or is it better that they are completely baseline to have that interactive experience with a coach or a therapist?
So to get to the research, I mean, most of the research so far in the clinical trials has been so this is with synthetics, and I'm most familiar with the psilocybin research. I mean, there's research into other psychedelics as well, but with psilocybin, it's mostly with synthetic psilocybin, and as opposed to the whole mushroom, which has, a number of alkaloids, psychoactive alkaloids, and it's with 25 milligrams of psilocybin analyte. So that's, okay. If you're looking at, a whole mushroom equivalent, it really depends on the strain of the mushroom, depending on how potent the mushroom is. And so that's, anywhere from, depending on the strain, 3 to 7 grams of mushrooms. So, we're in, so-called macro dose territory with that. So that's most of the clinical trial research, and it's with 1 or 2 doses that we're seeing when you look at the results from those trials. We have not explored at all the sort of middle ground, and even microdosing. The studies are, largely limited to just observational. It's pretty weak data as far as, as far as clinical data goes. But there's a blue ocean here for anybody who wants to, do research for the middle territory. And most of the model here in Oregon is a non-directive facilitation approach. And so the facilitator is simply there just to hold the container and make sure that you're safe, and to be, pretty neutral and not really guiding the experience. The thing that's guiding the experience is music. We always have music playing, and your own psyche really is what's guiding the experience. And so, but to answer your question further, I do think there's ample territory for what's, so-called psycholytic kind of levels of, or psycholytic therapy. So, it's just like a softening of one's normal egoic defenses that would normally prevent you from making progress in a therapeutic, traditional talk therapy session, or even like deepening, like a hypnotherapy or a sound therapy session, where you just have the softening, with kind of those middle ground dosing. I think there's so much opportunity there.
Yeah, I just couldn't help but intuit that talk therapy might be afforded, like you said, a softening of the ego or letting go of the resistance, because I've got a lot of experience with psychedelics. And so what I noticed in the macro doses, I'd be laughing too hard or too incapacitated to seriously engage a therapist or a coach or a partner or whatever. But that at that middle ground, and I was a big mesodose person, I guess, back in the day. I would drop half a tab of acid or only eat maybe 2 grams of mushrooms or whatever, and not get incapacitated by the experience, so that I could still interact with the world. But I'm just curious. I wonder if talk therapy may have some inroads to I don't know. I don't know if that's something that would be of value to a therapist to soften their patient up. Like you said, it's almost like hypnotherapy where you're a little more open to suggestion, doors open and things like that. So I don't know.
Yeah, no, I think there's definitely, I think with MDMA therapy, assisted therapy, it's more, can be more like that. And even here within the framework here in Oregon, it's an adult use model. So you are, you're engaging as a client with a facilitator, and it can be for any reason. And those middle doses are taken, and it really does depend so much on the individual, what the depth of experience ends up being. And and I think, there is, as non-directive as it is, like if a client wants to engage the facilitator in conversation or dialogue during that session, which a lot of clients do, then, we're there to be almost like more like a mirror. participate. And I like to, I engage in reflective inquiry. So if somebody is wanting to engage in dialogue, say in the experience, or especially when, even if you take a large dose, towards the end of the experience and you're sort of starting to come out of it, but you're still in that softened state, a lot of times people will engage in dialogue then. And so, and I take a stance of more just reflective inquiry in those moments. And I do think it is therapeutic for sure. And that's also, it just depends on the individual, how you process. A lot of people, though, are not verbal processors, especially, in those settings. But yeah, I for sure think there's an application for it there.
Okay. Now, I think this is a good opportunity for you to share that in your practice with Meadow, you are doing it. There were two types of licensure, I guess, for Oregon, and there is adult use, and then there's also what I guess is medically supervised, or you can fill that in for me, and that you are in the domain of just being a coach or being an assistant. And can you explain the nuance between, I think, the two types of licensing, I guess, and what you do as the facilitator at Meadow, or the person who is overseeing everything at Meadow? I think you said in a conversation that I listened to that you are not approaching this as a medical physician or a clinician of any kind, that you are more a facilitator who is essentially coaching folks. So could you share that with us and open that up?
Yeah. So the two licenses that I have are, I have a medical license, so as a medical doctor, and that would allow me to engage with people in a doctor-patient relationship legally. And then as I hold a psilocybin facilitator's license, and that allows me to engage with people as a client facilitator relationship under the Oregon Psilocybin Services Program framework. So there are two different, governing bodies, and, two different sort of systems, really. And there initially was a lot of concern about just scope of practice, keeping the psilocybin facilitation separate from therapy services and medical services and all of that. Okay. And so, I was engaging with clients, as a facilitator, and they are my client. But it's interesting. There's a new bill that's actually going through the Oregon legislature right now. It just passed unanimously by the House, and now it's up for vote in the Senate, where, that separation is no longer necessary. That for people, there's like a new, dual license status within the state, where if you are a dual license holder, you are now going to be allowed to engage with clients as both, say for me, as a doctor and a facilitator. I no longer have to kind of separate out those identities and those roles. It was a bit of semantics anyway, because I can't help but bring my medical knowledge to my work as a psilocybin facilitator, which has been really useful with clients who have various medical conditions. And so I can maybe take on certain clients that other facilitators wouldn't necessarily feel comfortable taking on. But it's nice that there's actually now just explicit language within the regulations that make it such that if I do engage with clients in a more medical capacity, then I'm not going to be disciplined for it by the Oregon Medical Board, for example, or if plenty of other facilitators are also licensed therapists or nurses, nurse practitioners, are all carrying licenses from the various governing bodies. And so had to, a lot of people had some trepidation with pursuing a psilocybin facilitator license for fear that they might be putting their other license at risk. I was willing to take on that risk, but a lot of people weren't. And so now there's explicit language so that you can operate as both.
Okay. Good to know. Which gets me to another kind of going out there with my imagination question. Have you, and speaking of imagination, put on your Imagineering hat as a physician and thinking, I've been to physicians who are sort of integrated practices or doing novel approaches to things like oxidative therapy and chelation and things like that. Now, with psilocybin and perhaps in the future, things like N,N-dimethyltryptamine or any other things that might have good therapeutic value, have have you thought about an integrated practice where you can maybe work with people who you're seeing in the sort of psycho-emotional somatic loop of, I know you've talked about autoimmune condition and other conversations, and maybe not necessarily autoimmune, but that which psychological distress brings to the body in terms of wear and tear and disease and things like that. So have you imagineered like what a future might look like where you can bring your medical prowess to bear on an integrated therapy with psychedelics?
Oh yeah, absolutely.
Okay,
I mean,
okay. Kind of an obvious question, but I'm like, that just seems to fit really well.
I'm a very sort of like vision, like visionary person in terms of envisioning the long-term vision for what, I mean, I think it's no secret right now that our current healthcare system is just utterly in shambles. It's just not functioning well at all. I mean, all of the local hospitals here are in various forms of, whether it's bankruptcy or there is a lot of merging, which is not good ultimately for the price and cost of healthcare. Every time a hospital system merges with another, prices go up and the care level of care goes down. So, I mean, there's a lot of sort of regulatory capture, which is part of the problem there. And we're, relatively free of that, in the framework that we have, at least here in Oregon, where we're just like kind of this separate system. And I sort of envision a, system in the future where psychedelic therapies are integrated into every aspect of care. And that it is, it's wild to me it's wild to me that you can go through cancer treatment right now and not have access to psilocybin therapy to go along with it. Like, it's so obvious to me if you look at, just like what, for what the experience is, plus what the data, clinical trial data we already have with it. That it should be part of everybody's treatment who's going through, cancer treatment. Nearly everyone could benefit from it. Of course, not everybody, but, that it will be just become part of the standard of care. And then anyone, I mean, just if I look at my own field of orthopedic surgery, we have so many patients who go through really traumatic experiences, where there's whether it's motor vehicle collisions or any number of accidents, you name it. And there's real a PTSD afterwards that gets completely neglected in the current system. Like there's no great treatment for it. Like for just simply processing what has happened at a somatic level. And so to me, it's like, it's amazing now how I get clients who are cancer, in various stages of cancer treatment, or, maybe the treatments aren't working, who are seeking out care for themselves, or people who have experienced accidents and are in a chronic PTSD like state from that, and who are seeking out the services on their own. And so whether or not it'll be completely integrated at the level of the healthcare system or be kind of like a complementary standalone system is sort of to be determined. A lot of that probably really does just depend on how regulations shake out on the federal level. But I do see it becoming really foundational once people really understand the role that our mind plays in our physical health.
Yeah, absolutely. And you're right. There's a huge paradigm or huge wall in medicine that my cynicism arises from the sort of mechanistic view that science takes. So there's biology and science, but it has to be so guarded and so rigid, and it has to almost mechanize the living system, which is necessary to put bolts in broken bones and suture things. But like you said, there's a missing component of the psyche, of the mind, and how the mind is reacting to all of this. And there is some of that, I guess, but maybe there's certainly room for improvement. And that's perhaps, again, where at a small scale, at a micro scale, that what you can do, and maybe you are doing a demonstrative evidence and proof of concept that you can have this integrated practice. As you said, maybe it won't trickle up to the big bucks, corporate for-profit, because that seems to be the motive. Although we could be cynical and say that they'll come up with an analog or some kind of, psychoactive thing that, whatever you want to call it, Blissanol or whatever, and that, and they'll capitalize on it. It'll be $1,500 a dose and yada, yada, yada. So we could get really, really, really hard and cynical about that. But in these nascent years, it would be wonderful to see people like yourself who have a medical background, who have a background in chemistry and biology, who really, because that's one of my critiques of the psychedelic renaissance, is there's a lot of, I don't know what the right word is without sounding too judgmental, but there's just a lot of people exercising facilitation that could stand to use better training and better, and maybe not necessarily, in the United States, but maybe globally, that people are seeking this out. And it would be great if everybody would, I'll say it this way, it would be great if everybody was at a higher level of awareness, again, for the pharmacology and the psychology and the biology of what's going on there, as well as being just good faith practitioners, that they're there for the person and not just to, process people through and make money and stuff like that. So sorry, it's a bit of a soapbox there, but I guess,
I
it's
resonate
not too controversial.
Yeah. No, I think it definitely, it is really interesting because I think, if you have relatively straightforward, healthy clients and people, then, you really just, the main skill for a facilitator is loving presence and, obviously being ethical with your, with your care. It's when you get into, folks with various medical conditions, whether they have cardiovascular conditions or kidney or liver or something that like conditions that alter their metabolism of the medicine. And then also if they're on various medications that can interact, that's where I do see that a lot of facilitators do feel kind of out of not quite comfortable with facilitating necessarily for those clients. And I do like to stress for clients who are not, relatively straightforward, to make sure you do seek out a facilitator who does understand these things. Unfortunately, a lot of physicians don't know anything about psilocybin or psychedelics, and so they're not of much help if you try to consult your doctor, ask them for their opinion. And that's something I'm really passionate about too, which is educating other physicians just about, it's not too complicated. Psilocybin is well understood in terms of the pharmacokinetics and pharmacodynamics. What is not as well understood is sort of the various interactions yet. But it's, it's not cardiotoxic or nephrotoxic or hepatotoxic or neurotoxic. It's a very safe medicine overall. But yeah, like I do hope that there will be more healthcare professionals entering into the psychedelic space, especially as they're being used more and more for intentional healing and therapeutic purposes.
What I'd like to do is have you walk us through a person who wants to go to Meadow and work with you, and walk through the preparatory work, the screening, pre-screens, and also the environment that's created at Meadow. I researched you guys, and it just looks so wonderful. So let's take a theoretical patient or Susan, and what is Susan going to do when they want to engage with you and have that therapy and that transformative experience?
Yeah, so we have an initial application on our website. I try to share a lot of information free online in various places. So I have social media accounts, I have a website, so that we can put out as much information as possible so people can do their research and feel like they feel good about what they're looking into. But we have an initial application just to see, just like basic screening questions, just to see if you're safe to move forward with psilocybin therapy. You're not a good candidate if you have a personal or first degree family history of schizophrenia, bipolar 1, or any other psychotic disorder, for example, if you've taken lithium in the last 30 days, if you have active suicidal ideation, just like those are basic safety screening questions. So if you get through that, and then, you have an initial free consultation with a member of my team. There's also a licensed facilitator. And so that's really just to explore whether or not you're a good fit for our services in the program. Just explore what you're moving through, what draws you and calls you to the medicine at this, why psilocybin, why at this time. Explore what work you have done for yourself, like kind of where you're at in your path.
Okay. Whoop. Okay.
So we have an initial application, and that has the basic safety screenings. And then once we pass through the initial safety screening, there's a free consultation with a member of my team. So that member of my team is also a licensed psilocybin facilitator, and that's just to explore whether or not we're a good fit, depending on at what stage in one sort of healing process someone is in, and what your intentions are for seeking out the work and that sort of thing. And then after that, if someone decides to move forward with us, then they have a one-on-one virtual session with me. That's a health intake. And we just kind of go through just like a 360 review, very holistic approach.
Okay.
And then start getting into the preparation phase before the journey. And so once someone chooses their journey date, that sort of informs the rest of like your preparation. We give you guidance, for preparing yourself physically, mentally, emotionally, psychospiritually for the experience. We have a nice little video sort of mini course, to also help guide in that process. And it's just, entering into a period of, contemplation and introspection. Then there's sort of the 3-day immersion. And so a lot of our clients are actually coming from outside of Portland and outside of the state even. So, that's when you have your 3 in-person sessions at the center. And so the day before the journey is a 1-hour in-person session. And I work with a co-facilitator now, and bringing on other members of the team too, as we sort of expand, to help serve more people. And so, that's the in-person session at the center. You get to kind of acclimate to the center, explore the space. I say it's a good way to kind of get your nervous system kind of attuned to the space as well. It helps to calm any nerves for the day of too. That's all very intentional with having that in-person preparation session the day before. And then there's the journey session. Most people are coming in to do large dose, individual journeys. And so that's usually about, a 6 to 7 hour, day at the center, with both me and my co-facilitator. And then the day afterwards is a 1-hour in-person integration session. And then there is a follow-up virtual integration session. Those are each just an hour long. There's one follow-up a week later, and then we do follow-up periodically after that. And there is an option to drop into group mentorship classes, monthly group classes, or meetings it's just for any clients who come through. It's just ongoing integration support with me. And that is the practice so far.
Wow. That's great. And it's so comprehensive because again, if a person, and I can speak to this, I'm a poster child for that, doesn't have that follow-up and that integration and the processing that can occur. That I don't know if that would nullify the actual experience and the value that may come out of it, but the burden is on the person who is unguided or not prepared rather to integrate everything that happens, especially at higher doses. That's got to be pretty profound.
Yeah. The integration is key. It really is, because people can have pretty massive, experiences, it's like full on like ego death experiences. So there's a lot of sort of loaded term there. But it's really just a complete talk about paradigm shifts, but like, we have our sort of construction of reality as we know it. And then when you have these psychedelic experiences that many times feel more real than sort of default mode reality, that can shake up your foundation quite a bit. And so having someone to kind of, decompress and process with, especially someone who has walked, those paths many a time, the people I like to work with, like as co-facilitators, are people who are, quite experienced psychonauts, people who just journeyed plenty on, themselves. And so have run into whatever kind of, issue you can run into, we've run into ourselves. We've experienced it ourselves, that experiential learning. So, oh wow, you were in the void for eternity. Yeah, same.
Right. Completely locked. Yeah.
And it's just like, oh, I experienced like my death or my mother's death. Like, okay, let's unpack that. And nothing is, we've walked all of those. We know the territory quite well, so there's little that surprises us at this point.
Okay. Has anybody, this is a bizarre question, but has anybody ever requested to have themselves filmed while in the throes of this experience, or is that something that would be probably not productive or helpful? It was just a weird question that popped into my mind. Like, I don't know.
So you can videotape the sessions if you wanted. There's actually a form from the Oregon Health Authority like asking for consent for that if you did want to. Most people do not want to have any video evidence of their journey, So we're like, hey, what stays here, doesn't leave here kind of.
Right. And just like any good therapy session, you're going to be a hot mess. I would, if I had a complete, I would probably be curious to see myself in that state, because then I would probably, in this weird circular way, connect with myself again in the video saying, oh my God, there he is. And I recall most of it, but there I am crying and being vulnerable and breaking down and maybe horrified. So just to say that, to see that in myself and just to connect, make an empathetic connection with that person again, that is me, but the me of a week ago or whatever. I don't know. Maybe it's probably more than most people want to bite off, but I'm just thinking, I'm like, what would that do? Would that be upsetting, or would it be like, oh my God, there I am. So vulnerable, so, sweating and shaking and, whatever's going on. And I don't know. I'd be curious to know if there's, if you could aggregate like people's reaction to that, or them seeing themselves and then saying, well, what did that mean for you? So it's like a secondary analysis of the experience. But
absolutely. You've experimented, yourself, it sounds like a decent amount. So I think like, okay, well, it's natural to then want to explore that. I would say most people who are coming to me are new to psychedelics, and they are specifically seeking out an above ground legal, by the book kind of experience with a doctor. There's sort of the first kind of hurdle to get over, which is this intense fear of like, what will I find there in that space? So I think most people are, maybe initially wouldn't be interested in that, but for sure, like when you bring it up to me, I'm like, I would do that. Like I would, And we're even exploring an offering now. This is brand new. Is sort of we've been ideating with the team, which is creating like a digital journal entry, sort of like field notes to kind of play off of the Meadow theme, which is like you're going on this exploration of your psyche. Would you be interested in just maybe the day beforehand in your preparation session to like doing like a short little interview where we kind of like, it's like a little snapshot, and then doing the same thing in your integration session the day after the journey, taking a little snapshot and just witnessing kind of the transformation, also just having like a little time capsule of yourself. I mean, just like before and after, and then you get to really appreciate, especially down the line as an integration resource, like almost like a little journal entry of like, oh, wow, that's where I was at that time.
Yeah. No, that would be highly valuable, I would think. For most people. I mean, there's some people may not be their style or what they want to, introspectively or retrospectively adhere to, or as part of the practice. But now, when you say field notes, as pointing to Meadow, is Meadow a metaphor of consciousness of the terrain that's being explored in psychedelia in the experience?
Yeah,
Okay.
for sure.
Okay.
There's many sort of things that went into kind of choosing the name Meadow. I mean, I had a wonderful journey in a meadow in the Sierra
Oh, okay.
Nevadas one time.
Oh,
That was, transformative, but also, weaving in sort of like this idea of the medicine of the earth, so deepening with, especially with psilocybin mushrooms, sort of this idea of kind of, rooting down into the earth as, Mother Nature as teacher, as wisdom carrier, and, the transmissions that can come through, through just like that deep sort of engagement with nature, and awakening to our own true nature, but then also, as sort of a metaphor of exploration, and then
right.
also that it doesn't have to be so scary, our psyche, so there's
Yeah.
actually wonderful territory in there to explore.
Yeah, meadows are generally peaceful and tranquil
Generally
places.
friendly environments.
Butterflies, flowers. Yeah, yeah. When I think of meadow, I'm there with the butterflies and the wildflowers. So that's my meadow. Yeah.
Yeah,
No
yeah.
tigers, right? Yeah. No scary things, shapeshifters
Yeah,
running
yeah,
around or
it's
anything.
not the
So,
like the deepest labyrinths of, something an
yeah.
underground piece.
We don't want to evoke that. No. Speaking of the videoing oneself when one is vulnerable, I had a phencyclidine experience when I was like 16, and I thought I was just smoking pot, but it was PCP, and I didn't realize it, and it tasted so bad. I'm like, I better smoke a lot of this because it's really crappy, pot. And I kept exteriorizing. I kept leaving my body, and I think now, and just bringing that up, that I would love to have seen my facial expression and bodily presentation or whatever when I knew I was clearly out, hovering around the room somewhere or whatever. I think that would be fun to see, poor Justin at 16, like completely befuddled by by the inadvertent dosing of PCP when I thought I was just getting high, and, oh my God, that was such a day. But that would be neat, because there was even an experience walking down the hallway where I had to turn around and tell myself to catch up. Just seeing all of that, I wouldn't see the non-me, but anyway, that just came to mind, and just a mild tangent. So thank you for indulging me in that. But I think that would be really hilarious. I'm a kind of a joker, so I think that would be kind of funny. See poor Justin all dosed out of his mind on, yeah, dusted, as they
Oh
say.
my gosh, that must have
Yeah,
been
yeah.
something. Yeah.
It taught me a lesson that day. I was so lucky. I had a friend in the second. This was first period. I walked in. I was right, like before school. I made it through first period completely gone, and I went to my second period, and I had a friend, and she had experience with angel dust and PCP, and so I said, I need you to be my babysitter. I'm kind of okay right now, but I said, I just want you to keep an eye on me. She's like, okay, yeah, no problem. So she was my little angel that day. She kind of.
So this was on a school day.
Oh yeah, I was a kamikaze. I was insane. I was pretty nihilistic as a teenager. So I'd drop acid in school, take PCP. I didn't want to take PCP, but yeah, I did. But yeah,
Wow.
there were times when we would take acid at school, which was, no, don't do that. It's not
Yeah,
anything I would
not
recommend.
recommended.
No,
Not
but
my ideal setting.
yeah, but we had fun, because when you're 16, you're naive, you're dumb, so it's, I think, like I couldn't take high doses of LSD now as an old man, because I would have so much emotional baggage on board. I'd have to ramp up or be very cautious, in the approach. But at 16, I devil may care, and it's like boop, and just having fun, and everything. So there was levity there. So I guess the preparation and the anticipation and all of the baggage that might come with it was not necessarily there. So it was usually a good time. Usually
Hmm.
we would have fun. But no, I would not recommend that to anybody. And we were awful to each other. Like, we knew who was tripping that day, and we would terrorize them. We had these little things called fry toys. They were little finger puppets, and we'd walk around and just try to, get into people's heads and stuff. So whoever came into school on acid was going to get hazed by everybody else.
Real. Oh my gosh.
We were bad. We were bad, but
Where did you grow up?
in suburban Washington and DC. So yeah.
This is Washington, D.C. suburbs. That's where I
Yeah.
mean, that's where I spent my high
Oh,
school
okay. Yeah.
years. But we didn't
Bethesda.
have LSD around.
Oh, okay. Yeah, this was the mid '80s. I think the first '86 was the first year I dropped and took acid or whatever. And did it not a lot, maybe 4, 5, 6 times in high school. Sometimes at school, but sometimes out just in nature doing stuff like that. And when I got out of high school, I actually started doing it more. But then I was mesodosing. I would take less than 100 micrograms, just so I could still function. In fact, some of my best experiences was to take probably 50 or 60 micrograms and just go thrift shopping.
Yeah,
yeah, because you're just more appreciative of where you are and what you're doing, and no visuals and no distortion, and you can function and carry on. And if you'll forgive another tangent, I found that as somebody who was very hard-headed and not necessarily in touch with their emotions, that my heart would just open, and on a moderate dose, like a mesodose, and my heart would just open, and I would actually feel positive valence, positive affective states for the first time, and they felt genuine. They were obviously facilitated by the serotonin dump, but just my heart would just open, and I would just be in love with things, and just feel good. And so that was really nice, because I was very hard-headed as a teenager and a child and an adolescent. I just shut down a lot of that stuff, and so this was a nice way to break it open.
Yeah, so it was therapeutic.
Indeed. Yeah, I was mesodosing when it, and partly I didn't like to lose control. So like the PCP thing taught me a lesson, and had done mushrooms a few times. And then, of course, moving to Florida, the first thing I did was know where the cow pastures were. And I got smart. I brought the cow manure home instead of getting chased off and shot at by farmers. I would go and get cow manure and bring it home, and they would show up after about 6 weeks, and mushrooms would come in. It's like a yard full.
That is organic. Yes.
Yeah. Well, in fact, I have a job right now working for the state, and I'm constantly in cow pastures. So I bring it home for my bananas and my mango trees. I have a lot of fruit trees, and occasionally the mushrooms will show up, and I'll take a little picture of it. I don't really I don't engage with it anymore, but it's fun to see them, and I see them out there when I'm working and stuff. So little buddies are out there.
Yeah, they grow everywhere. I think that's another thing people don't realize. Yeah, is that they're native to every continent but Antarctica.
Right. Yeah, they're all over the place. But yeah, they helped a lot, I think, because again, I would medium dose with mushrooms in my early 20s, and I was depressive and again very nihilistic and very hard-headed. It was just childhood adversity, things like that. I had to shut down for various reasons. So that really brought me back into my soul, into myself. So I owe a debt of deep gratitude to that.
Beautiful. Yeah, that's the medicine.
It is. It really, and I can reference that. So if I'm being hard-headed, I can be like, no, do you remember? Yeah. That's who you can be. That's how you can express yourself as a person.
I mean, and I would say that's actually our true nature. And that's part of the journey that we're on, to get to the sense making and the purpose and the meaning is that, like, why are we here? What are we doing here? What is a human life? And there's many different interpretations, we're all sense making organisms. And it's really, I think, what's sort of, interesting about the times that we're in now is that it's not just handed down to us by some authority. And that's like sort of the centralized, just accepted narrative or way of making sense. It's a lot more individualized here. And especially since we have access now to wisdom traditions from all over the world, we get to source our information and our research and, from that and have that inform things. But it's interesting how you can even look just within within the Christian tradition, let's say, we're in the West and that's like the water we swim in. But this idea of sort of, like falling from grace and then becoming saved again is like, in the story of Jesus. But that's like, in a way, if you look at sort of, like more modern, more secular interpretations of that, even just from like a neuroscience perspective, it would be like, well, okay, we're in union with the mother in the womb, and then we are born into separation, to this world of duality, and then we become a separate self, and it's necessary for our survival to develop this egoic identity that is a separate self. And depending on what are, the families and the circumstances that we're born into, and some people may choose the meaning of that I chose this family in order to catalyze my own soul's evolution, that whatever adversity that you face in your childhood then led you to develop, say, this nihilistic kind of adaptation. And that's a very common adaptation. So I would say that that's one of the most common adaptations, why we see depression as prevalent as it is the cutting off of oneself to, cutting off of our hearts. And we should just protect ourselves, because it's not safe to deeply connect. To be deeply connected, because we've been sort of scarred in that way, that we're taught or inherited the belief that it wasn't safe to do that. And so, but that cuts us off from our vitality, that's just even the joy and the beauty that's available when we're just walking through a thrift store doing the most mundane of things. You can staring at a tree,
Right.
Yeah. We become, and part of that too, I think, even if you don't face any childhood adversity, is just part of the, I don't know if you're familiar with Ian McGilchrist's work. He wrote The Master and His Emissary, but it's this idea of sort of left hemispheric faculties, the dominance there. And that's just part of, just part of our makeup, and also reinforced by the world that we're living in. But we fail to kind of come back into balance in our right hemisphere, have that more kind of balanced, that balanced perspective. And so it's a sort of this process that most of us, I would say, are going through, where we kind of lose ourselves, or we fall into, however you want to characterize it, closing off of our hearts, shifting too far into left hemisphere cognitive processes, and then eventually reach a point where, we're self-medicating, if you will, with psychedelics. And it's like, oh, wait, like something, I want to explore something else here, because this is, this can't be all there is to life. And then you have these sort of like these other experiences, and kind of, it's like a coming home to oneself. And then you awaken to the ways that you've kind of fallen away, or adapted or conditioned yourself to your previous experiences in the past. And then you wake up to that and realize, oh, wow, I don't have to keep like operating with that operating system, with those old programming. I can actually sort of update my programming to reflect my here now reality, which is no longer in that situation, that caregiving situation I was born into, and get to, and it's a real sense of empowerment or sovereignty to be like, oh, wait, I get to consciously co-create my reality now, which does require a period of deeper understanding, introspection for, why our conditioning is the way it is. But then you eventually get to the point where you're like, okay, I can let go of that conditioning a bit, and then have the flexibility of mind to explore in other ways.
Right. Well, what I love about what you're doing and the greater psychedelic awakening, reawakening, or whatever it is, this generation's capture is one thing I like to think about is that transcendence can be afforded or facilitated by ritual and disruption. And psychedelics provide the ritual and the disruption. They kind of like that Cesar Millan with the dogs, and you go like that, and the dog's like, oh, wait, yes, he's off on some barking tangent or getting aggressive. So that's what I love about us bringing this, us as a collective, the West, bringing this into our, you said something about homing a moment ago, and that's something that's important to me, because I think a lot of us feel unhomed within ourselves. It's a domicide that occurs because of, as you pointed out, Western sensibility and the inheritance of the Enlightenment project, which brought us a lot of wonderful things, but it divorced us from our spiritual nature and our sense of wanting to be spiritual. So and people are religious, but religion has become instrumentalized. And it's like you were saying, the lesson learned in Christ's sacrifice and being born again, or however you want to frame that. One perspective is when you stray, when you sin, you're leaving or moving colder away from the true good and the beautiful, which is kind of what Christianity adopted, Platonism, and that's kind of the tenets of that, is that you're moving away from true good and beautiful, which could be an unhoming process. Again, like you said, we're born with this innate capacity to be tender and use our empathy for good, rather than being empathy for manipulation or anything like that. So long-winded, but yeah, I totally agree. And psychedelics are a disruptive tool and a ritualistic tool, because if you think about shamanic ceremony and even, I guess people going for ayahuasca now, but when ayahuasca was originally the original folks that were doing that, it was very much ceremonial and very much sacred. And that I appreciate about the psychedelic renaissance as it's being facilitated by folks like yourself, is it's a necessary part of our humanity, where we've come from, because modernity was disruptive in another way. Yeah.
Yeah.
So
I mean, I say it's really like a return, a return to our ways that we, I say it's, these practices, there's evidence of these sorts of practices all over the world. I mean, and who knows how ancient it really is. I mean, there's the whole stoned ape theory, and Terence McKenna and that sort of thing, or the theories that soma, if we look in sort of like, sort of ancient Hindu texts, that might have been a psychedelic plant or fungi. And then, of course, there's the Eleusinian mysteries in ancient Greece and in Europe. So there are various, ancient ritual sites that have evidence of psychoactive or psychedelic substances in the chalices and in the sites. And so, yeah, and then there's, there was sort of the birth of the Abrahamic lineages along the way. And I think that sort of overlapped with the development of alphabet-based writing systems, and that writing as a it was a technology and just what writing as a new technology did to our brains and psyches, and how that was actually, it's fascinating to see like how that is reflected in our spirituality actually. And again, going back to like kind of the hemisphere dominance theory. So yeah, like I do think that this is really just a return movement. And so it's not actually this new breakthrough therapy. It's actually an ancient medicines and practices that we just sort of lost along the way. And that I think as a species, and as, specifically like American, Western American society, I'm just fascinated by this idea of reintegrating these practices into our societies and culture, and what that really looks like, and how it evolves. And I think, it's all like an experiment really. And just a further evolution, like we're just, as human beings, as these creatures, we're just constantly kind of iterating on our whatever our inheritance is. And so, I'm fascinated by the question of like this interweaving and reintegration of, whether it's science and the sacred, or, mind, body, and spirit, is coming into, if we think about healing as really the process of becoming whole, what does that look like? What does it feel like? What does, and especially in an age when, I would say like affiliation with a particular religious ideology is like at an all-time low. So, there's still though that deep desire to gather and to commune and to have these direct experiences. It's like it's fascinating. We're in the thick of it right now.
Yeah. Well, I almost wonder if not just psychedelics, but the sensibility that arises from insights gained through the use of psychedelics could be used as a psychotechnology like writing to help reform current existing belief systems and wisdom traditions. Not that you can sort of reach back into the past and change what's already been laid down, but more that we lens it differently. We have a perspectival shift, and we break frame from where we are now. So I would indict, and I'm an American living in the West, and I was, had Catholicism voiced on me as a child. So I would say that, what the role of religion is presently, could use reforming, and that reforming could be more of a, less X theory kind of social engineering, social management, cultural, lodestar kind of stuff, and more into getting, again, in communion with whatever it is that you want to define as spiritual or sacred or whatever that is. But just, and this is not a full indictment of where Christianity might be or any as you said, Abrahamic system might be, but that frame break and that perspectival shift could be facilitated by the sensibility and insights gained through sacred medicine and plant medicine. I don't know how that would happen. I know that there are sort of Reformed Catholics who are kind of Buddhist Catholics, like Brother Thomas Merton and Richard Rohr and some of these guys who are doing little integrative practices. And so maybe there's going to be these, these guys, persons that come along and their salience, what they say resonates with people. And that will shift, the glacier a little bit, to get people to say, oh yes, and I can still keep the teachings and the wisdom of Christ, or any of the Abrahamic systems, but the ends are shifting a little bit. That I'm integrating a different way of communing, I guess, with the teaching and the wisdom. Maybe, I don't know.
Yeah, I wasn't even familiar with that sort of I was going to say that remixing of Catholicism and Buddhism.
Yeah, that's
that. That's interesting. Yeah. That's really interesting to me.
Yeah, there's a few people out there. Thomas Merton passed in the 60s, but late 60s, early 70s. But yeah, he was a Trappist monk, and he just he was a hedonistic Oxford student. Then he became a Trappist monk. Then he kind of had this awakening again within the monastery in Kentucky that he was in. And he went off to the East, and he was hanging out with the Dalai Lama and doing all these conferences with Buddhists. But he kept his Christian tradition, and he just had this kind of integrated perspective of the convergence and the overlap that occurs. And there are others like Richard Rohr, I think is his name. He's also doing this integrative practice, and I'm all for that. And it's not that we want to directly try to converge, but I think if we can be informed by the sages and the wise people and the salvific people and all these things that we use as these icons for our growth and our transformation, that we need to break some barriers. Yeah, because I think a lot of the barriers that exist are because of fear. It's one of the tenets of Christianity is if you don't do what you're told, you're gonna like have to suffer all eternity and blah blah blah. We need to be, we can still use hell as a metaphor. We can still use damnation as, again, you're getting colder, you're becoming too much of a whatever, and bring yourself back. And that can stay, but don't get caught up in the fear. That can be pathologized, I think. And there again,
sure.
Yeah, psychedelics can help you break that pathologization or whatever of that fear, because that's what really controls a lot of people. And that's a shame, because there's so much beauty.
Yes, I agree 100%. Like that really transcending that fear-based control, those control mechanisms, and yeah, I do feel like, just as, like a youth, growing up in sort of like the 90s and 2000s, like I think like I was raised in, Christian churches and various denominations my family attended while I was growing up. And I guess it never really sat right with me that, that this idea that Christians are saved and nobody else is, like that. I remember like specifically contending with that what I was learning in my, in my classes at the church. And yeah, like there's so much wisdom contained in all these other traditions. And it's like, yeah, how does one, like, there's so much benefit that I've derived in my life from, specifically from Buddhism, that has helped me so much with my own suffering. Like, and just like, and it wasn't something that, I could really grapple with until I was older. But yeah, like how do we kind of integrate these things? It is fascinating to see. I mean, I see so many people doing it, and also these kind of newer interpretations of just these old stories, whether it's like Jordan Peterson, his series, which I think that's his best work, honestly, is sort of his more mythopoetic interpretation of the Bible and those stories, and what the sort of the archetypal dimensions and interpretations like that resonates with me quite a bit. But yeah, it's and John, I think also like John Vervaeke's work. I don't know if you're familiar. Yeah, like
he was. I had him as a guest.
Did you?
He came on. I was so lucky. Well, I brought him in through some people that I'd already interviewed, and I said, "Do you think John would be?" And John and Mike Levin and Greg Enriquez, who's wonderful. He's a professor of psychology at James Madison, and they three of them came on, just had a chat, and I was sort of the salon host. But then I had John on individually, which was just absolutely wonderful, because I've watched all his stuff on the 50-hour lecture series and After Socrates and all these kind of things. So those are the kind of thought leaders that that you mentioned, McGilchrist and Vervaeke, and there's a whole bunch of Chris Fields is a good guy. He's doing this sort of that overlap of our spiritual pursuits, but guardrailing with science and what are we understanding about our ontological primitives. Bernardo Kastrup's been on probably 5 or 6 times, and he's really interesting because he's reviving idealism, which speaks to a sort of universal consciousness kind of thing, and so he's there fighting the good fight against materialism and all this kind of stuff. So, but yeah, just these good faith actors that are showing up and sort of cracking the as John says, breaking frame. You're breaking frame and reperspectively, lensing things, and that's what it's going to take, I think. And one of John's things that he says is stealing the culture, which is what the early Christians were doing. They were setting up something new, right? They were getting in.
Yeah. Oh, that's fascinating.
Right? Yes. Yeah. And that's what I'm sort of envisioning. If there are good faith actors, persons that show up and they are stealing the culture. But yeah, I don't know what it looks like. I don't know what a reformation looks like. Because we are so in the West, committed to individual perspectives, that it would take that frame break first, I think, and it's not that you go to again, we don't want to go polar here. We don't want to go to, a kind of strong collectivism either. It's something that oscillates. It's something that has the freedom to move when we are approaching the sacred. I think that, so it's not relativism either. It's affording ourselves space to be ourselves as we express ourselves spiritually. You know what I mean? If that makes sense. But also
it's adaptive and as my friend would say, pragmatic, adaptive. It's not
right. Yeah. So it's not an easy undertaking, but I think people are starving for that. I think that's really, which is why the psychedelic renaissance is so popular. It's that people are starving for meaning, sense, purpose, all these kind of things. And I certainly think it's doable. But much like a psychedelic experience, I think there is a ritual of preparation, a ritual of clearing, set and setting, all this kind of, these are all good metaphors for maybe that large macro scale immersion into the future, a new paradigm, a new yada yada, that at least Western, I can't speak for anyone else but us in the, in the West, Europe and the United States right now, but just that we, have to see that work as being sacred itself. There is no out there, right? The work itself is sacred, and that is spirituality. When like I consider what you and I are doing, or any conversation I've had where we're going into a space and we're talking about things that are meaningful, that to me is very spiritual. That we are
The
having
dialogos, as
the
Vervaeke
dialogos is right. We invite the dialogos to be with us in this conversation, and that it's beyond the two of us, and as you say, our egos, and that it is the will for the good, the will for something new to show up, some new salience to open up. So yeah, I think, and there's a lot of people I think that will, when things start to move, I think that there will be it will be well received, because without getting soapboxy, I just think it's a good time and a good space for people to take it seriously and move in. And that's what I love about guys like McGilchrist and Vervaeke, is that they are offering things that are different and novel, perspectives and ideas that are different and novel. And there's a whole bunch of other folks too that are being brought forward in good faith, I think. Yeah.
Oh, yeah, yeah. And well, I think it's interesting too, because I remember hearing Vervaeke speak one time about, just with everything that's happening in the world and collectively right now, I think there's been so much focus on the political kind of angle of tackling, problems and solutions, and how I hope I'm representing him correctly here, where he is like that's not actually where the real change will happen. It's actually through the spiritual dimension. That's how culture change. Culture is downstream of spirituality. There's spirituality and culture, and then politics is like further downstream of that. And so like really when we and that's sort of what inspired me too, when I, feel moved about like, things that are happening, world events and like what's happening. And like, I have children now. And so I have skin in the game for helping to make the world a better place.
Yeah.
Like what is really going to be the like high leverage thing that we can do for humanity here. And I think like it's spiritual work. It's reconnecting with our spirit being, like that which cannot be named. It's just this like this awe and this like reverence for the mystery of it all again.
Right.
And I think when you have an embodied direct experience of that, which you get to do with ritual ceremonial use of psychedelic medicines, especially I think the earth-based ones, you start to like, I think like specifically, it's the most pro-social thing we can be doing as a species. And so at a time when we're talking about, like AI alignment and like all of this stuff, it's like, I think there's like for me, there's no more important work than this right now, which is like helping people to, commune with themselves and their own, whatever it is, your higher self, your spirit, the source consciousness, whatever it is in this way. And that's enough, that is actually, I just like keep holding onto this, this belief and this vision that if, enough people do that, it actually doesn't take, especially when we look at, like the advent of the printing press. I remember I was listening to another interview with Dr. Andrew Weil, who was like the father of integrative medicine. And he was saying that, when the printing press was invented and, literacy was previously confined to, the elite scribes. And that it took, it didn't take everybody, achieving 100% literacy throughout the population, but just simply 10 to 15% more literacy within the population was enough to shift every major institution and give birth to, the scientific enlightenment as we know it. And so, and his, vision was that with the psychedelic renaissance, the same thing, that we don't need 100% of people taking psychedelics, but when a critical mass of people do, we may similarly see a radical shift in our institutions. And that really inspired me. I'm like, okay, wow. So, that seems doable. That seems achievable. If we have 10% more people like having these experiences and reorienting their entire value system, the entire value, like hierarchy of values, what happens? Like, cause our institutions and our systems are simply made up of individuals.
Yeah. Collectives.
That really excites me. And, And yeah, I don't know I don't think anybody really knows what it looks like. It's just like we simply like move forward. Um, you know, like move forward at the rate that we can, and then see what unfolds and what births. And I'm also really you know, I don't know if you're familiar with this idea that, you know, in some circles, like the prophecy is that the second coming of Christ is actually a collective consciousness, not actually within one person individual, but that
Yeah.
it's a distributed network of people.
I'll take everything you just said and I'll bring it back to you in sympathetic resonance, but I'll use a different set of words, and that is when you talk about the printing press and a paradigm shift that occurred there. It was also we were moving from feudalism into the Smithian capital, Lockean Smithian capital system, and so there are the social theorists who would talk about the society of the sovereign, which was feudalism and the emperor and the king and all this and that. Then there was a society of surveillance, which came with the Enlightenment project, but also the onboarding of modern capitalism. And now you have people like Deleuze, the post-structuralists, who are saying society of control, which is where society of surveillance is the panopticon that Foucault talked about, and Bentham's architecture, where you have one station that supervises, and so you feel like, you know, you're under surveillance, and so that you are going to have a set of deontological or moral normatives because you are being watched, and so we could be that panopticon. We all keep each other in check. Like, are you really gonna take that $10 from that old, you know, that kind of thing. And then Deleuze comes along and talks about the society of control, where we basically participate in our own surveillance by engaging with social media, engaging with the internet, the big tech companies. You know, it's all information farming and identity farming and all this kind of stuff. So wouldn't it be nice, when you talk about the emergence of the Christ consciousness, that the next society is not so much of these Theory X kind of ideas, but it's more that, you know, we depathologize our values and power relationships and dynamics and things like that, and that it's more again of what the Christ-like values might be, which again goes to Platonism, which John talks about a lot, or Neoplatonism, which is the true, the good, and the beautiful. And we could certainly have a conversation about defining what true, good, and beautiful mean. But if you want to be charitable and take this is again where we have to not relativize, but also be fluid and say, well, you know, what is true, what is good, and what is beautiful. And to be true to somebody is like, I'm being true to you right now in a sincere conversation. I'm being true to my wife when I abide by what we agree to do as a couple, you know, as being responsible for each other. So that's the kind of true. Good, obviously, should be, you know, the walk in the meadow and the experience of beauty. Like we were saying before we hit record, going to the museum, going to the performance of music and just being lost in that for a moment. And then the beautiful is that as well, you know. So I almost wonder, and I brought in those three societies, but what does another society look like where, again, we are pro-social, as you said. We are seeking non-hedonic affective states. So I always look at eudaimonia versus hedonia. We're trapped in, you know, hedonic reward right now because of the market system, and I hate to, you know, indict neoliberalism, but it thrives on dopamine and thrives on reward. But, you know, what does eudaimonia look like? What does a pro-social society look like, where we are more concerned about welfare of the individual as well as the others, you know, which can be done. It's the what were we talking about before record, where we can hold something in tension and not feel like there's a dichotomy there, like it's either me or you, or, you know, it's more that it is me and you and all
positive sum and not so
right. So I'm going down the Beatitude Row, but it's just like that. I would love to see enfolded in it. I think again that's what people like John and Ian and Bernardo and guys like and Matt Siegel, who I mentioned earlier, he's doing some really amazing work in this regard too. And the process relational people are doing a lot of work like that. So who knows? Maybe that's what Christ consciousness descending or transcending looks like. Is that, you know, we take the you know, even if you're a hardhead and you're like, well, maybe there was a Christ, maybe it's what we talk about. It's the capture, just like Buddhism. It's the capture. It's the Eightfold Path. It's the Four Noble Truths. It's, you know, what Christ taught about, you know, his teachings and parables about, you know, being a compassionate human being and being one who is willing to sacrifice, which I think to me is the greatest takeaway for Christ, that he was willing to give it all to make a point, and so that for me is my catcher. So anyway, long-winded tangent, but yeah, I'm totally in harmony with you on that's what the aspiration should be, perhaps. Rather than some escapism or, again, more hedonia, more narcissism, it's more, and that's what I love about psychedelics, is they're like, no, there won't be any narcissism here. You may get a little hedonia, but, we're right. You giggle for a little while if you're in that stage. But, it's about, like you said, getting back to that self that has always been there, but may have been walled up, and crack that open. Yeah.
Yes.
So
maybe that's it. Yeah. Coming home to your authentic expression, which, like, if you think about it in this, our core needs as these social sentient creatures that we are, I think that we cure all manner of social ills when we can just simply be with each other, and feel that safety, that value, that belonging, that security that I talked about before. And it's not coming from a place of lack, but it's just completely self-sourced, in this way that just anchors us in a way that then, what is the ripple effects of that? I find just like, it's been fascinating to experiment with that just in my own self and in my own social circles with sort of friends who are on this same path of self-discovery, and just the positive benefits in that way. And so it's like, oh wow, yeah, how does this look on a wider scale? It makes me, it certainly helps provide some optimism, much needed optimism.
Yeah, absolutely. And I think the best medicine for anyone is to go on media diets, social media diets, and get out there in the meadow, and get in touch, or get with a group of friends that are good friends that have your interest in mind, and you can relate with really well, and do more of that and less of the immersion into the hyperbole and the amygdala capture and all that kind of stuff.
Yes.
That's what I call the news. It's amygdala capture.
Yes,
there's very little content that I need. I need to know the weather, maybe a little bit about the financial markets, and what our crazy politicians are doing this week. A little of that, but not too much, and not just little bites, and then I'm good, and then I'll go back into my whatever it is.
I call it the rage machine. I'm like, when you're wanting to indulge in some rage,
well, it's what sells advertising. Yeah, it's what sells ads. So
Exactly. Ever since I watched the documentary The Social Dilemma, I mean, it's fantastic if you haven't seen it.
No.
I mean, I recommend it to everyone. I'm like, there's no informed consent when it comes to social media use. And this is, if I were ever going to, develop a process of informed consent, it would be like, please watch this before you engage with social media. And then you see sort of like what's at play here. And right now we're all sort of just like, emotional capture captives, like it's just like we're become puppets for things. And so, there's very little conscious use of social media. Like, I think there's a lot of, people unconsciously perpetuate all sorts of monstrosities without even really knowing what we're doing here. And how we're plugging in, and also the effects that it does have on our psyches is like deeply subconscious processes here. And so I'm always like, that's part of preparation, integration for all of my clients. I say it's a principle that is informed by indigenous, wisdom lineages, which is you have a dieta, and your dieta is not just what you put in your mouth and into your body, food wise and nourishment, but also what you put into your psyche and your mind. It's like playing Russian roulette, when you open up the apps. And so, and I think you can be very conscious in your use and very intentional. And there is that's possible, but that's not how most people are engaging with it. And then you see the deleterious effects of that. It's amazing. I do in my intake forms, like a tech use screening as part of it. I have like I take a depression score, anxiety scores, all the same, measurements that are used in the clinical trials, but I also do like a tech use, and it's amazing to see like just how prevalent is like, like, are you using, your phone like as soon as you wake up or right before bed? And like across the board, like that's the default mode of living right now. And I'm just amazed. It's like, no wonder you're struggling in your mental health, it's like that's like the first sort of boundary to have. And so yeah, I think we are, we're in the very, beginning innings of this, right? Like it's in its infancy, this ability to be connected to like billions of like unconscious behavior and psyches. So, so yeah, it's fascinating to see how technology does play a part in all of this and navigating all of that as a modern human.
Yeah. One of my little moderate concerns I have is what you're touching on here. And there's a professor in Macau, and he's German, but he's in Macau teaching Eastern Studies. And he, on the side, he kind of does social systems theory work with people like Niklas Luhmann and Guy Debord and Marshall McLuhan and a few others. And he talks about this very dilemma, especially in the tech native generations. People, I'm old, so I was around before computers and stuff. But the idea of the prophilic self and the curation of a prophilic identity. So there is the sort of subconscious self. There is the id or the superego that Freud would talk about, or the conscious self, the identity, the persona, the egoic self, and then there's also the prophilic self that is an abstraction of the self. And he's concerned. The concern there is that the folks who are digital natives, who are under 35 or 30, who might find it harder, as you're saying, to separate and detach from that, because part of their, they're strongly tethered to that identity that is TikTok or Instagram or wherever they are. And that's a concern of mine, especially when it comes to new and novel iterations of pathologies, or species of pathologies that might be coming up. When again, like you said, there's so much toxicity and assaults that occur and things like that now you have three tiers or three aspects of a self that can be affected by that. So that's something I like to watch and keep an eye on. And I have no answers, but it's like caveat user, just be aware how deep you go into that, and how deep. And that's such a blessing about being middle-aged, is that I go to YouTube for mostly informative things, like either horticulture, botany, or people like Vervaeke and all the other guys that they talk about philosophy. That's about it. Sometimes I watch planes and trains and stuff, dumb things, but that's it. And if I go to Facebook, it's botany and horticulture. I follow gardening groups and plant groups and cats. And that's about it. I don't get
same.
Right. So I'm very simple. Right. Most young people are like, ew, what? Yeah, right. You geek, dork or whatever I am. So yeah, but I love it. I mean, and so I hope that I'm not, casting myself into that too much, because I try to just extract my eccentric, esoteric or self-centric kind of things that I want from it. And that's it. And I don't want to I don't engage with strangers, and I don't make comments, and I don't make friends with people I don't really know. I usually don't take friend requests too much or anything, just for the sake of being a neutral observer in that environment. And again, just going there for cats and plants and right, flowery things. Yeah, right. I like cat humor.
Yeah, that's fascinating.
And dogs.
Yeah.
Dogs too, yeah.
Yeah, I came of age where I didn't have social media until my senior year of high school. Facebook was at the time just limited to college students. And so you had to wait until you got your college email to get access to it. You could register for a profile without having a college email address. So when we all got accepted into our schools, I was so excited you could make your Facebook profile. And then, so I did go through my undergraduate years with Facebook profiles and Facebook, and then Instagram came along later. And so, I feel like I'm in this sort of like in between generation that I sort of get it. I sort of get that idea that you were just like the prophilic identity you were saying. And yeah, I feel like I just got a taste of the pathologies that are available there to experience,
Right.
especially as a young woman. And I know that
Mm.
social media does seem to be disproportionately affecting teenage girls,
Yeah.
especially with like all the focus on sort of the visual kind of, representations and expectations there. And so, yeah, that's really fascinating. Yeah. Yeah. That's like just like another, yet another like layer of self to navigate through.
Yeah.
It
Wasn't
wasn't
enough
hard
just to,
enough already.
yeah, yeah, to have that Freudian Jungian self or Adlerian self or whatever. But yeah, now it's the avatar self. It is that which you curate, and and it could
Yes.
be idealized. And like you said, young women are being assaulted because maybe they're not hypersexualizing enough. Maybe they're not fetishizing their looks enough, or doing Botox at 10 or whatever, whatever
Oh, yeah.
god awful things that are so yeah, that is, I don't know when that's going to show up as young adults with a whole new set of things that psychotherapists are going to have to contend with. And I hope there are people who are sort of prognosticating and saying, this is coming. And this is a new, so I would have garden variety psychological psychiatric issues as a 55-year-old, but the 22-year-old now, or the 18-year-old, is going to have a different dynamism to themselves in terms of their psychic signature, their psychosocial, psycho-emotional profile that I have, and I can be totally screwed up, or any 55-year-old could be totally screwed up. But I wonder that dynamic, prophilic, expressive self is going to be different. And but maybe the modalities of treatment can address that. Maybe what might work for this person might work for that. So I don't know, but it'd be interesting. So if you're in this practice for 25 years or 20 years, you're going to get some patients who might have those kind of stories, like, oh, my teenage years were, a nightmare, and I want to get through this, and I want to heal that part of myself because of what I endured as a young woman or a trans person, or anybody that was on, social media in the 20 teens and now, and all this kind of stuff. So anyway, yeah, it'll be, I hate to be Irish for a minute, but they'll be clients and they'll be different.
Oh,
Yes,
yeah,
maybe.
exactly.
That's my gallows
Not a
humor. I'm
shortage
sorry.
of work. Yeah, yeah. It is, thank you for that. Wow, that is fascinating. I hadn't really heard of that conception of sort
Yeah.
of like, yeah.
I can send you his link, Hans-Georg Moeller. He's an interesting guy. And what's cute is you were mentioning this about consent. In the beginning of every one of his videos says, warning, this video was designed to capture your attention for the sake of exploitation. So he has his own little a caveat that he puts on his videos. So he's being a little ironic there. So he's a good guy. And I try to wick up, just like Vervaeke and the other guys, I try to wick up as much of his stuff as I can, because it just makes sense, And
Wow. Yeah, it does.
Yeah.
It totally does.
So, Dr. Townsend, I think we've given the audience. I might break this into two parts and find it if I can. I like I said, I rarely edit, but I think maybe I'll break it and we'll have a part 1 and 2 that comes from this, because we've been going for about an hour and 50 minutes, and so maybe that's a good thing to do, and we'll get it out and I'll release the same day and all of that. So if that sounds good to you, but now before we say goodbye and before we close out, is there anything that we didn't cover, didn't talk about, anything you want to just share as a closing thought or an idea, like Vervaeke does? I always give the guest the last word. That's what he always does. And I like that. So I want to ask you and check in with you. Is there anything that you want to share before we close this one out?
Well, I guess I typically share at the end, just like if people are interested in learning more about my work, where they can find me. I mean, it would just be through our website, which is meadowmedicine.org. And I share on social media. I'm Tracy K. Townsend, MD, whether it's on Instagram or YouTube, or you can find me on, Twitter/X as well.
Okay.
I love for anyone who connects with the episode, if there's anything I shared that resonates. I love hearing from people whenever they hear a podcast that I've been on. So yeah, don't hesitate to reach out and connect.
There you go. Well, I can't thank you enough for being here. I knew it was going to be a good conversation, but it delivered. I think us getting together and talking about what you do, and then letting the conversation flow, I feel great. I think I feel rewarded for having you as a guest.
I feel it was a fantastic conversation. I mean, and now I
Good.
have so many other threads I want to pull afterwards. You seeded.
Oh, yeah. Well, if you want, maybe in the fall or after the holidays, we can bring you back. And because I would like to get some of your client feedback, if you would share some anecdotes, and maybe we can frame a conversation around what you're seeing, what's going on, in the trenches with the psychedelics, and things that you can share from patient experience or client experience. So maybe we can bring you back in about 6 months and do
I would
that.
love that.
Oh,
Yeah.
wonderful, wonderful. That warms my heart. All right, what I'll do is I'll say goodbye to you after we stop record, but to the YouTube audience and the Spotify audience, I always forget to say that. Thank you all so much for being here, and I'll have all contact information down below. I should have said that in the beginning, but I'll have all contact for Dr. Townsend and Meadow and her socials and everything down below. So bye-bye, everyone. Take care. Let's see.